Welcome to Voices in Leadership, live streamed worldwide from the Leadership Studio at the Harvard T.H. Chan School of Public Health. I'm Dean Michelle Williams. The goal of Voices is to highlight the experiences of leaders confronting major public health frontiers and to better understand effective leadership and how it can affect change. I hope you find this program engaging and informative. Thank you for joining us.
Hello and welcome to those of you here in the studio and to our viewers online around the globe. I'm Eric Anderson, the Director of Voices in Leadership. This series focuses on effective leadership to create positive change in public health. We're broadcasting from the Leadership Studio, where the programs and related content have received over 4 million views to date and counting. Today we host a discussion entitled Harnessing the Power of Nursing to Build a Healthier World, a conversation with Dr. Stephanie Ferguson. Dr. Ferguson is a global healthcare consultant with more than 35 years of experience designing, implementing, and evaluating health-related strategic plans and programs. She has worked in more than 100 nations as a technical advisor, consultant, and facilitator for the World Health Organization and the International Council of Nurses. For WHO, she develops initiatives to strengthen and evaluate global healthcare delivery, population health outcomes, and health profession education and services. At ICN, She directed the Leadership for Change program and the ICN Burdett Global Nursing Leadership Institute in Geneva, Switzerland. Dr. Ferguson was a White House Fellow from 1996 to 1997 with President Clinton and Secretary Shalala at the Department of Health and Human Services. She is the president of the White House Fellows Foundation and Association. Dr. Ferguson is an elected member of the National Academy of Medicine, the American Academy of Nursing, and the National Academies of Practice. She is a consulting associate professor at Stanford University. Before I turn this discussion over to our moderator, Professor Sara Bleich, please join me as we welcome Dr. Stephanie Ferguson to the Voices in Leadership series at the Harvard T.H. Chan School of Public Health. Thank you.
Dr. Ferguson, welcome.
Thank you.
It is so nice to have you here. Can I call you Stephanie?
Yes, please call me Stephanie.
So I would love to start by just hearing about your path, how you became a nurse and how you got to here.
Okay, very good. Well, I'm one of those people, I always wanted to be a nurse. And when I was young, I had quite a few people in my family who were nurses and just enjoyed being around them, listening to what their stories were, working with the patients. Most of them were community public health nurses, working with people who suffer from mental illness. And then I had asthma and still do as an adult, so I spent a lot of time with the school nurse. And I thought she was the most magnificent person in the world. And when I found out that I was not the only student she was taking care of, one day I said to her, "So how many students do you take care of a day?" And she said, 1,000.
Wow.
And I said, I want to be this person. And so life went on, and I just loved her, and I realized, she's a school nurse, but she's also the county nurse, and she takes care of 1,000 of us, but then she takes care of a population of 10,000, and it just changed my mindset about how a person who has a passion for children can change the world and help students like myself who suffer from asthma, parents working, couldn't come and get me, and that was shaped the rest of my life. So once I told everybody in the family, I really want to be a nurse, because you always get people, why not the physician? It's like, no, I don't want to be the physician. I want to be the nurse. And I think the curve changed too when I did a lot of research on nursing. And I realized, nurses are scientists, nurses are the leaders in public health, nurses are at the forefront of innovations, caring for the people. I'm going to get my PhD. So can you imagine 5, 6, 7-year-old child? I'm going to do this. I'm going to get
You said you wanted to
Oh
PhD
yes. I was that child. Planner, strategist. I'm going to go here. I'm going to do this. I'm going to do this, and I'm going to change the world. But you know what? Most people are like, okay, thank you.
You stuck with it.
Yeah, but I stuck with it, and I went all the way. And so here I am today at Harvard with you all, just to share a little bit of that story. I always had a passion for women and children, and particularly children. And so from that journey, being with the public health nurse and the school health nurse, really got into all the different steps it would take to be a nurse. So my parents were wonderful. They're like, look, if you want to be a nurse, then you need to be a volunteer at the hospital. See if you like being around sick people. Okay, and I did. I loved it. Okay, well, if you want to be a nurse, then maybe you need to go to school and become a nurse's aide. So at age 13, I went through a lot of legal work-related issues to get a permit to be able to work that young as a child.
Wow.
And to go to, at that time it was Lynchburg General School of Nursing, which they are Centra School of Nursing now, so they're still in existence. And I went to school and became the nurse's aide, et cetera. But at that time, you could not work with children and maternal child. You couldn't be in that space. Most of the people I cared for were the elderly, the sick. Mm-hmm. I mean, back in those days, as a nurse's aide, I'd have like 40 people.
Wow.
That's a lot of people to care
for. At 13?
At age 13 up. Wow. And so I did that all the way through high school and also through college. At the University of Virginia, I was a nurse's aide the whole way when I was there. And I was an nurse extern at the University of Virginia in the pediatric ward. And so eventually, as life went on, once I went to the University of Virginia School of Nursing, which I absolutely loved, 2 degrees from there, my baccalaureate degree and my PhD. In my baccalaureate degree, I was one of the students I was chosen to be in a track where you could do part of your experience in the wellness track and part of it in the illness track. And it was great for me because in the illness track, OR, ER, labor and delivery, pediatric intensive care unit, et cetera. On the community side, working with the community action agencies, being in the health department, working with the school systems, et cetera. So it was able to blend all of that. Plus, I was a Spanish major, so getting the language skills right, making sure that you could communicate with all the different populations. Then fast forward, when years of service, I came back to UVA, and so my doctoral degree is very unique because of the way the University of Virginia is designed. So I have a background in primary healthcare, public health, health systems, and then also multicultural education and community psychology. So that's who I am as a person. So you see, all of that knowledge and skills helped me. After I did the bedside, then I also realized, because of teen pregnancies and children being born that were very small and very sick, it's like I need to go and see what's happening. Why is this happening? And I was a scientist at that point. It's like, this is the same zip code. This is the same school system. This is the same neighborhood. This has got to stop.
Right.
And so as time went on, I really wanted to be in public health, and so I became very active, working with the Virginia Department of Health. I was the nurse consultant, the director of the newborn screening program for the Commonwealth of Virginia. So it took me from the micro level to the macro level to really be able to become the scientist that I wanted to be. And so writing all those maternal child health block grants, making sure that we have the right health workers for women and children, families, fathers, making sure that we were able to have the right resources, building the partnerships with Medicaid, building the partnerships with Women's, Infants, and Children's Program, working with all the politicians, 4 governors later. And so that took me then to finish the PhD and then go to the White House, because I was a White House fellow. I was a SAMHSA pre-doc, and I did a lot of research at NIH, but I did not want to go do the postdoc. I wanted to do the White House Fellowship as my postdoc, because I want to go global. And so you can't go global if you haven't done anything in your own country. I love people. I want to go be the head of X, Y, and Z. Well, let's start local, and let's start regional, and let's start in your country. You have got to understand, you have to understand how your country works. So for me, I wanted to go and see how my country worked at the highest levels. Now, mind you now, I had worked in Congress on behalf of the Commonwealth of Virginia all my life, for years as that nurse. But I wanted to see the executive level, and I wanted to see what it's like to be with the President of the United States, and also a secretary. And in my case, I ended up with Donna Shalala, so the rest is history, because I know you all, everybody.
She's been here.
Oh, yes, she's awesome. But can you imagine being her White House fellow, being with her for a year, shadowing her everywhere, working with her, seeing the Clintons come out of a major loss with health reform. Being with her, because she is just so dynamic. She also has a passion for women and children. So our thing is, okay, I came in as secretary. What can we do to change things? Well, it's hard to get politicians not to want to help children. So we're like, okay, we lost this, but let's go for the kids. Let's take care of the kids. Kids need healthy moms. Kids need healthy moms and healthy fathers and partners. Kids need healthy families. Let's make the Children's Health Insurance Program work for everybody. And so I worked with so many wonderful people at the Department of Health and Human Services, and we were able to get that through. So when I look back on my Clinton years with Secretary Shalala, first of all, a master leader, master consensus builder, highly political, but also able to cross over and work with everybody. And so when you look at those times, yes, okay, we didn't get health reform in, but we got Children's Health Insurance Program. I think this is one of the landmark health policy achievements and legislation that got passed through. The other thing was welfare reform, because in the state of Virginia, we had already been doing welfare reform, getting people to work, getting women and children in the right place with the right people. I mean, even as an executive at the state of Virginia, I had people who worked for me who were welfare to work. So you always had people, what is it like? Are they able to do it? Yes, listen, anybody who lives in a situation where it's crime-driven, organizational, crime bosses, drug-infested, et cetera, you can do all things.
And what do you think of the parallels to what were the big health reform debates now?
The parallels are similar because what happens is people come into these offices and they're like, this is my time. I'm going to change the world. I'm going to bring all my buddies and we're going to sit in a room and we're going to do it. Failure. Absolute failure. Because you can't do it. Yes, of course you can have the kitchen table conversations. But then if you want to change the world, you got to bring everybody to the table.
Right.
So what I see now, just a group of people, I'm this, you're that. And so you don't come right here.
It's too tribal.
It's too tribal. Yeah. Oh, come on, people. And then everybody, I'm going to do this to you to get rid of you. I'm going to do this to you to get rid of you. But I'm the type of person that is, and what are you doing for people? What are you doing for the population? Okay, if you don't like the Affordable Care Act, then how can we fix that? It's hard to go and jump from one incremental health policy program that you put in to do a total rehaul on a country like ours. And we have people all the time, well, but Sweden does this and Finland does this. Yes, and they're this big. And I love them. I love Sweden and Finland. Don't get me wrong. But we have a lot of people in our country, rural, remote, urban, lots of different issues going on now with the opioid epidemic, et cetera. So we have got to have people come to the table. So a lot of the parallels is it was very divided back in 1996.
And it's very divided
and
now.
it's very divided now. And what I learned from being at those tables is I did exactly what I did in Virginia because we had to get along back in those days. Now you will see now Virginia's got some divisions with the Dems and the Republicans, and now it's all Dems. I tell you what else I've learned. When you get all of the same people, they don't get along. And the next thing you know, it's like, well, what did you all achieve? And most times people can't tell you because you didn't achieve a thing. So what you need is to get people to come together. And so for me, being with Secretary Shalala, she let me do what I knew how to do, which was to work that hill, get as many people in the United States of America to buy into welfare reform, buy into the Children's Health Insurance Program. And then we had a passion for science. So a lot of people don't realize, but I think what will go down in history with the Clintons is giving research to biomedical research, really funding NIH and all of what I call the departments of health services research and, ARC, all those different agencies for healthcare quality, NIH, SAMHSA, the whole gamut, CDC, et cetera. So we had the money for scientists to be able to do what they need to do to carry forward the models in public health, the models in biomedical. And now you see we're going backwards with that. I don't see the funding at the level I think the funding should be at.
Right.
We're going to have to disrupt everything we do. We're going to have to think about using different methodologies. AI is going to play a role, blockchain technology, and just using computer science to a level that we can't imagine to reach the masses. And so we need the money to study that and see what works. But I lived in a very divisive time. Remember, December 19, I think it was 1998, Bill Clinton was in the impeachment process. We're right back where we are. So I would look, I feel like a deja vu.
Yeah, there are a lot of parallels.
A lot of parallels.
And you've spent a lot of your career, we're going to talk about your consulting firm, but you've done a lot of work in public service.
A lot.
And what do you think for you have been the key things you've taken away from that have helped you in your career now?
Well, first of all, public service is where it's at. If you want to change things, you want to change the world, you have got to learn how to manage populations and work with people. And so for me, thinking big, that's where I wanted to be. I enjoyed being at the bedside. I was at the bedside for about 15 years of my life, but while I was at the bedside, I was highly political and very much so active at the highest levels of government. And so what I've learned is you have to have consensus. Most people like working with me because I try to get people to have consensus. If you just do a vote, the majority said this, the minority said this, you're going to have a lot of unhappy people. But if you can build consensus, say, okay, what can we agree to do? Just give me three things. Just give me, what can we agree?
And get everyone on the same
and
page.
get everybody on the same page so we all feel good about this. Let's have the win-win. And I feel like if you don't have that win-win, you're not going to move it forward. Thinking strategically is another key thing.
Yeah. And judgment.
And judgment. Critical thinking. Using evidence, using assessment. This is not about your feelings. This is about the evidence is showing. We have done our assessment. look what we're finding. Look where the gaps are. Look what we could do. Look what the science is saying. Look where the models are. Let's replicate. Let's see if this works with this culture. Let's see if this works in this community. So I think, being at the high level and working at that level, you also have the ability to understand finance and health finance and economics. And it takes money. And I think you'll hear a lot of people, well, we can do this for everybody. Are you sure about that? So for me, also sustaining, making sure things are sustainable. Worst thing you can do with a group of people is to give them something and then take it away from them. Mm-hmm. And so those are the things that being at the table. If you're not at the table, you've heard many people say this, you're definitely on the menu. My thing is this, you can still be at the table and also be digested. So it's a fine balance, and you can appreciate this because you're in nutrition. It's a fine balance. It's a fine balance, what you're taking in, what you're doing, how you're working with everybody. But you need to be at that table.
So another big part of your life is that you have this consulting firm that works all over the world. Yeah. And so you could have taken a clinical track only. You could have taken an academic track only. You could have just spent your career in public service. You've done all those three, and then you've also decided to have this real entrepreneurial spirit and actually go out and sort of serve as your own consultant. So talk to us about that decision and sort of how that has shaped your career.
Well, I come from an entrepreneurial family. Mm-hmm. So when you really do a deep dive, my father, owned a trucking industry company, mother in nuclear regulation, one brother who, basically works with people with aviation, rich and famous, building airplanes. And then my other brother, as he said, keeps the lights on in many places, cybersecurity, et cetera. So we all own our own companies and everything. So it's in the family, as I say. For me, having your own enterprise, it puts you at the table in a different way because it's a public-private partnership, so you become that partner. So it's not just you are that employee. Does that make sense? Mm-hmm. No, I'm that partner. How about I know way more people than you do, have much more influence than you do, and can turn this around. So people like that. And also it allows people to see you in a different space. And we've got to do things where we work with business. We can't do business as usual. We have got to bring businesses in. We have to bring all sorts of people who have those backgrounds to be able to turn that curve. So I've been in that space for a long time. And I actually like having that space for where I can go into WHO and be the person who won the bid. Does that make sense? Mm-hmm, mm-hmm. To turn it around. So you're in 1 foot in, but you're also 1 foot out. Mm-hmm. So you can also be the advocate. So it gives you more power and it gives you more opportunity to really be able to be that partner and to not only do a return on investment, but in my case, a return on impact.
And do you think that allows you to be more objective?
Yes, absolutely. Absolutely, because you're not only the scientist, but you're using the evidence to back your business, where you think it should go, how many people you can get into a particular intervention. Then you can wrap that back around and do the evaluation. I mean, this is who I am. And then you can do that presentation for the United Nations and say, here's what we found. Here's what we found in this region of the world. Here's what it looks like. Here's how all of you can come together and work on these 3 different things and make a difference for the entire region. You can replicate that and take it to the entire world.
Mm-hmm. So this is a big year.
It's a year of the nurse. It's a big year. Big year. 200 years it took us to think, when I look at it, I'm like, well, thank you, Florence. I know you're dead now. But 200 years later, now we're going to celebrate the Year of the Nurse. So I'm very grateful to the Burdett Trust, the UK, the Burdett Trust for Nursing. I love them. They were very wonderful people. They helped me, really do the best we could do for nurses in collaboration with the International Council of Nursing to build the Global Nursing Leadership Institute, which attracts the chief nurses of the world, the chief regulators of the world, major academic institution deans, and the list goes on and on. Entrepreneurs, nurses in the world, bring them to Geneva to give them leadership and management skills at the top level now, how to run your country level, how to work together as a team to get that out, to get that voice out, to get that investment in nursing. So I'm excited about that. And also the WHO, because WHO, thank you, Dr. Tedros, he declared, along with the World Health Assembly, which is all the member states, that the 2020 will be the Year of the Nurse and the Midwife. Mm-hmm. And so we're excited about that. And the World Health Report, which is a huge deal with the World Health Organization, have a whole report on nursing. The whole report on midwifery will come out
you're
April the
involved in.
7th. Yes.
Right, because they do an annual report
They
every
do
year.
an annual report every year. So this year, in 2020, it's going to focus on nursing and midwifery. And then at the World Health Assembly, we're going to focus on nursing and midwifery. So it's time. My biggest thing with all of this is let's celebrate, let's feel the love, but let's move it forward. And so hopefully in 2021, I want to see a resolution. We need a new resolution for nursing and midwifery. Remember now, my life at WHO was working on nursing resolutions, working on nursing strategies, making sure we just finished the strategy for the Americas for nursing that just came out this year. The 2016-2020 strategy for nursing and midwifery will finish at this World Health Assembly. So we have everything in order to show the evidence, what nursing is doing, and also the gaps, and what we need to invest in so we have the right nurse at the right place at the right time doing the right work. I like that, when we think about harness, I have to remind people that I'm using it as a transitive verb, not, like a horse with a bridle. This is part of the problem. Some of the people, instead of, harnessing that power, they hold us back. And we can't practice at the highest levels of our license. And so we need to change that because you need to let the different health workers do what they are educated to do. And so when we look back now and we think about public health, we need to have public health once again be with us on that forefront, making sure that we have the right public health nurses who are out in the field, who are the majority now out in the field in many countries, providing that care. What models do they need? What resources do they need? What are the teams that need to be created? Because you can't do it all. One profession can't do it all. But how do we scale that up worldwide so we have those nurses who are able to be the leaders and the managers that we are to provide population health management?
And so we're sitting now in a school of public health,
I
but
know.
there are a lot of nurses watching this. And so for nurses who strictly do clinical work, sort of what advice do you have to them about why it's so important to bring in the public health lens?
You have to have the public health. The social determinants of health are real. So you can work in that ER and that ICU all you want to, but if you don't look out at the landscape and figure out where your patients are coming from, what they're dealing with, what are the issues with transportation, what's their issues with their socioeconomic status, what's their housing issue. If you don't know and understand that and look at that, you can do all you want to, you can give every intervention you can think. You can do all the patient discharge you need, but if you don't do case management, help that patient navigate the system, and help that patient not come back to you. I always tell people, I'm going to work myself out of this NICU. No more sick babies. No more teen pregnancies.
Right. Stop it at the door.
Just stop this at the door. Let's go get this straight in the community. So that's what I would tell you. The sky is not the limit for you. Make sure your lens is right.
And that's both in the U.S. and abroad.
That's abroad in the U.S. That's everywhere. Yeah, but you need to know what you're dealing with. You need to know the community you work in. That's the micro level when you get to the acute care setting.
And what about women who are watching this? Women who are thinking about a PhD, maybe I want to start my own company, maybe I want to go into nursing. What would be your advice to them?
Well, first thing is, what's your passion? And if you figure out what your passion is, what makes you get up whether you get paid or not? You like me, I get up, data. I love it. Sunday mornings, okay, God, how are you? And then look at what this data is showing me. So you got to know what your passion is. And so that's my first thing. Don't try to be somebody you're not.
Yeah.
And I see a lot of people, I want to be this, I want to be that. But what do you want to be? So you need good mentors in your life so you can have those deep conversations.
And full disclosure, you're one of mine.
Yes, she was one of mine, and she was a White House fellow. And also, I might add, and look where you are. And think about that. We had deep conversations.
True.
What's your next journey? The other things I find with women, sometimes I look at the CV and everything, I was like, okay, how much longer are we going to do this same committee? Okay, I think you've done that enough. You've been the head of this and the this and that and the this and that.
Something new.
Come on, you need to go, you have a lot to offer for the world. Time to move forward. So I think women need mentors, women need female mentors, but also we need male mentors. And I find sometimes people I'm like, well, why you just have all women as your mentors? You need a man in your life. You need some good, don't get all crazy now with just women mentors. No, you need everybody in your life. And you need, in my case, non-nurses, non-physicians, non-health-oriented people. So I think that is also something that I encourage people to do. Let me help you find some other mentors that can help you find what that passion is. The other thing I tell women is, I didn't get invited to the table. Well, just, it's always nice to ask. I'm a firm believer in that. But you're a citizen, so you can show up. Just show up. If there are no chairs, bring your own chair. Women, we're resourceful. You can find a chair. Get to that table. But volunteer to be at that table. At the World Health Organization, a lot of my students and everything, they become the rapporteurs. It's like, learn how to take notes, look, listen, and learn will help you when you get to the next level of the journey, because you'll know exactly what you're listening for, what people said, how they said it. Learn how to do that. That's at the table. You will be in that book. It'll say your name. It takes you to the next level. So volunteering, doing fellowships. A lot of people don't, I was a White House fellow. And for those of you who are interested in that, you can always talk to me about that. You can look it up. But it's good to do these type of fellowships. I was a W.K. Kellogg fellow. I was a community-based fellow for W.K. Kellogg. It was in collaboration with the American Nurses Association and the National Consumer League. But that turned the curve, because it was a time when we had HIV and AIDS and all sorts of things happening. So W.K. Kellogg's, we're going to teach you how to build the alliance. We're going to teach you how to do the strategy. We're going to teach you how to raise the money. We're going to teach you how to do finance and
Learn
health.
before you have to do it.
And now you're going to go out and do it. We give you all the money you need to do a project. So in my case, I did adolescent health and et cetera. But those are the type of fellowships you need to do and internships you need to do.
So in our last minute together,
Yes.
you have been to over 100 countries.
Oh, yes.
Which is your favorite? Which one has stood out the most?
I
What
think-
surprised you the
Yeah,
most?
that's a great question. Indigenous populations, we have so much to learn from them. Like Papua New Guinea. When I went into Papua New Guinea and I got asked to go in with the International Council of Nurses and the World Health Organization, they had a terrible situation going on with HIV and AIDS, and the babies were dying. So perfect person, because high-risk sexual behavior, HIV and AIDS, women and children, maternal child health, this is my thing now. And when I went in, I saw what women can do in tribal warfare, no resources, an epidemic that was very similar to Africa, particularly in sub-Saharan Africa, and how they dealt with it and how they were able to be resilient. So when a person like me comes in, okay, I'm going to give you the knowledge, skills, and ability. We're going to get your voice to another level. We're going to turn this around. Let's talk about this. What is going on here? Why are we having so much with this HIV and AIDS? And once we figured out what would be culturally appropriate, because you see I'm funny, my thing is, look, do we need to do a dance? Do we need to, what do we need to do? I'm willing to go anywhere. And they were like, we can take you to the right people. We have to go to the tribal leaders. We have to do this. They don't believe that this is what it is.
You meet people where they are.
And you meet them where they are, and you turn that around. So but I have many examples of the Papua New Guineas, the Yemens, the Fijis, the Marshall Islands. I mean, we could go down the list of all those types of countries that really have something come into the islands, come into their region that's causing massive disruption and massive health issues, and how with knowledge, skills, and ability, and letting people see you can turn this around with your government, you can make a difference, we can learn to ask for what we need, you can say it, we can break down these barriers but still maintain your cultural beliefs. We can do this together. And so I think those are some of the countries. Mongolia is another good example.
We're going to have you back to talk about the rest of them.
Yes, yes.
But now, thank you, Dr. Ferguson.
Thank
We're going to have to
you.
stop here. Thank you very much.
Thank you. Thank you. Thank you. Thank you, world.